If there's any questions that you might have, go ahead and feel free to put them in the chat feature. It's up at the upper right-hand corner of your screen. And I will go ahead and read your question to Adrian, and he can address it at that time. Adrian is coming from us again from Las Cruces. He is one of our board members with the Alzheimer's Association, very involved with our Walk to End Alzheimer's. And also, he is the administrator of Crossroads in-home care. So very fortunate. Thank you, Adrian, for presenting to us today. I know you probably are crazy busy during this time, so we really, really appreciate it. Right now, I'm going to go ahead and turn it over to Adrian. And again, if you have any questions, please go ahead and put them in our chat.
Thank you so much, Denise. Yes, it is a crazy time right now. I know we're all experiencing just a topsy-turvy world, and we're learning how to deal with the pandemic life that we're in right now. Like Denise had said, I'm the administrator of Crossroads in-home care, a director of operations at Tender Care Home Health, so I have a lot of experience dealing with caregiving, and personally, I'm a caregiver, so that comes from this angle as well, that I actually do caregiving myself. I've taken care of many loved ones, an uncle who was homebound in my house, and I was a caregiver for my grandmother in her house. And I do specialize in Alzheimer's and dementia with my organization at Crossroads. We do this because it's affected so many people across the globe, this disease. And it's affected me, and it's probably affected a lot of you. And if it doesn't, you probably wouldn't be here, right, learning about this. So in the recent times here, I've been studying what is the best practices in regards to taking care of patients who have dementia and Alzheimer's. In the clinical setting, we call them patients. Here with the Alzheimer's Association and in my company at Crossroads and Tender Care, we're going to refer to them as loved ones, because either we're working in an industry where we're taking care of people with dementia and Alzheimer's, or we're taking care of them at home with our loved ones. In the end, we still love them. So from here on in the presentation, you may see it say patients, you may see it say something differently, but we're going to refer to them as loved ones, okay? Because we're going to take care of them like we love them, okay? So just that's my background. That's what we're going to, bring to the table here. And what we're going to discuss is COVID-19. That's the hot topic. We cannot get away from this subject at all. Everywhere we go, we're hearing it on the radio, we're seeing it on TV, we're talking with our friends at a social distance space, right? And we're communicating in regards to this because there's so much that's unknown. Even with all the news that's out there, with all of the recommendations, with the CDC, with every single broadcast explaining what this virus is, in the end, we still don't know enough about it. That's why we're having so many problems and having to shut down the country, in essence, to make sure that we're not letting it spread, okay? So we'll start off the conversation with talking about how COVID-19 affects dementia in our loved ones, okay? So most likely, it doesn't increase the risk for COVID-19. Dementia does not increase that risk. It's a respiratory illness, and it's and just like dementia, it does not increase the risk for flu either. However, with dementia-related behaviors, increased age, common health conditions, which include chronic diseases that often accompany dementia, it may actually increase the risk of getting COVID-19. So what that means is people who have dementia and Alzheimer's, our loved ones, are actually at higher risk, even more so than people with just regular chronic diseases that are at high risk. Dementia patients are a lot more at high risk than even at that, okay? For example, people with Alzheimer's disease, all over the dementia categories, may forget to wash their hands or take the recommended precautions to prevent this illness. In addition, diseases like COVID-19 and the flu may worsen cognitive impairment due to dementia. Many infections have the ability to increase dementia in their patients and worsen the cognitive capabilities of our loved ones, okay? Since this disease is so new, the virus is really, really new, there isn't any studies to prove or show what percentage of people with dementia and Alzheimer's are having cognitive impairment exacerbated because of the virus. So we're just understanding from other viruses how it affects dementia patients, and in most other viruses like the flu, it can worsen the cognitive impairment. So the CDC has put out a list of information. What we did at the Alzheimer's Association is we wanted to get the best information to put it out there so that you guys in this webinar are getting the most recent and most accurate information possible. Okay, there's a lot of rumor, there's a lot of conjecture, tons of information out there that isn't necessarily going to be the best, and we'll go over a little bit of that during this presentation. For the most part, everything coming from the CDC has been vetted. They are the leaders and the authority of tackling this pandemic, okay? So working with them in order to bring this information to you guys is one of the best practices, and us at the Alzheimer's Association want to make sure we give you that best practice, okay? So the CDC is recommending for people living with dementia, increased confusion is often the first symptom of any illness, okay? If a person living with dementia shows rapidly increased confusion, you should contact your healthcare provider for advice. Immediately contact your healthcare provider for advice. That'd be the PCP, the person that your loved one is seeing for their dementia. Okay, unless the person is having difficulty breathing or a very high fever, it is recommended that you call your healthcare provider instead of going directly to an emergency room. What that means is that the emergency rooms are actually going to be a hotbed for the virus to spread. People who are not knowledgeable may feel the signs and symptoms of the COVID-19 virus and immediately go to the emergency room. Whether they're sick or they're not, they will be around people who are actually sick, and people who are coughing and people who are sneezing and spreading the virus around. Unfortunately, that is not the best place for someone with chronic diseases or even dementia to be in a room where there's people who are going to be sick. We want to distance them from those types of people as much as possible. So it's recommended you call your healthcare provider, call the doctor's office, and they'll make it so that they're able to treat the person without a visit to the hospital. Okay. So here, people living with dementia may need to have written reminders to support remembering hygiene practices from one day to the next. With dementia, we have a lot of memory loss and a lot of confusion. This is a tip that we give to a lot of people who are dealing with cognitive issues, not just dementia, is to write placing signs, post-it notes on doors and cabinets, common places where the dementia patient or loved one will go, okay, just to be reminding them. We want to demonstrate to them the hand washing technique. Now, I know this hand washing technique is being beat into everybody's head from every news source, from TV commercials, social media. Everyone is beating this hand washing technique into your head. I'm sure all of us can demonstrate it right now, washing your hands for 20 seconds, washing in the palms, interlacing the fingers, using soap and water, washing the back of the fingers, washing the nail beds, and then getting the thumbs, and then washing the palms again. Okay, one thing that we do in non-medical healthcare, and that we're starting to practice also in actual healthcare, is we're enforcing a different type of hand washing policy. This policy includes washing all the way to the elbow. So instead of 20 seconds just washing the hands, now we're washing all the way to the elbow. Okay, reason for this: when most people are coughing or sneezing now, and you don't have a tissue like we'll talk about later, a lot of people are coughing into the elbow, the crux of the arm, okay? When you're doing that, you're leaving the virus right here, right in the arm. That makes sense to wash all the way up to that spot and get it soapy, wash it off, rinse it off, and then use a paper towel, turn off the sink with that paper towel, and then toss that paper towel into the trash, okay? If that's not possible, always, always, always use a hand-based alcohol-based hand sanitizer with a minimum of 60% alcohol. That's a quick alternative to hand washing if the person with dementia cannot get to the sink or wash their hands easily. Okay.
Adrian, we have a question real
Sure.
quick. It's from coming from Wendy, and it says my dad has oxygen concentrator at night. Useful for him to use during the day. Some also. Do you have any advice on that?
I'm sorry, can you repeat that? The concentrator?
Yes. So my dad has an oxygen concentrator at night. Useful for him to use during the day. Some also. So
So to use it at night and also during the day,
yes.
that's definitely what should be talked about with your physician. And that's going to actually come up here real quick in the presentation. You want to actually give them a phone call, whoever is the one prescribing that oxygen tank for them. It's not absolutely something that is immediately necessary, but I would call the physician's office and ask them. They'll more than likely want to see how our loved one is feeling during the day, if they feel like they need the oxygen. But it's not going to help the situation in any ways, because the oxygen coming out is coming from a tank through the tubes. As long as the virus isn't in the tubage, or your loved one is not touching their face often, then that should help. But the extra oxygen, increased oxygen, probably isn't going to be something that helps. But like I said, you definitely want to talk to your physician and get that confirmation if that's something that you feel they need. Does that answer
Also,
the question? Uh-huh.
I believe so. But also, we have another question, and it is coming from Dominique, who asks if our loved ones has a fever on the weekend, should we call the doctor or the Alzheimer's hotline? And I believe there is a hotline that is 24/7 that you can call. At least I've seen it in New Mexico if somebody has symptoms that they're concerned about. Is that correct?
That is correct. I believe it's the 211, if I'm not mistaken.
Mm-hmm.
Uh,
Correct.
Dial 211. That should be where you call first. Now, the Alzheimer's Association isn't going to be able to make any recommendations as per diagnosis. Okay, so calling their hotline, probably they'll just send you directly to the Department of Health. So you'll want to call your Department of Health. Even over the weekend, 24 hours, they'll make themselves available. Now, the temperature that we're looking at is 100.4 degrees or more consistently. Okay, that is the temperature that is indicative of infection. So once you can notice that temperature being common in our loved ones, that's when you should definitely call. And then on top of that, you should also notice a non-productive cough. I think we all know the difference between a productive cough, a dry cough, and a wet cough, right? The wet cough is going to cough up phlegm, the nasty stuff that you hawk out of a loogie or you spit into a towel or whatever. That's going to be the type of coarse cough that is going to be not association with COVID-19. The dry, hollow, very, very deep sounding cough, that is the type of cough that is associated with the virus. So when you're coughing like that and you have a fever, that's the time you definitely need to call and have get recommendations from the Department of Health. Or also at that point too, your primary care physician, whoever's seeing our loved one, because they can also make recommendations to have them tested at a laboratory or one of the Department of Health test sites.
Great. Thank you, Adrian. Also, just a quick tip on if somebody's loved one does not or is not cooperating with washing their hands, what are some suggestions to still keep their hands clean during this pandemic?
That's a great question, Denise. A lot of people, when our loved ones who are dealing with dementia and Alzheimer's, they don't tend to be the most hygienic. We know this. We know that they don't like to take showers. A lot of times they're going to be difficult to get them to wash their hands on a regular basis. One of the tips that I've given my caregivers that work for us is to have the hand sanitizer. It's very difficult to get hand sanitizer right now, but if you can get it, that is actually one of the best ways to make sure that their hands are washed. Okay, what you would do is you would put the hand sanitizer in your hands, a good amount, and then you would get their hands and kind of massage them for them. Still doing the same technique, interlacing their fingers, and making sure you get as much coverage over the hand as possible for them. Okay. One thing that should be followed up, and my suggestion is to actually follow that up with a little bit of lotion, because I don't know very many people who don't want to get a nice hand massage from time to time. It's soothing, it's relaxing, it might even help calm them down. Um, there's going to be times, extremely difficult times, more so during the sundowning period of the day, where the loved ones may even be a little combative. They don't want anyone near them. And at that point, you have to ensure that everything else around them is sanitized and cleaned. Because if you just can't get them to wash their hands, and you can't do hand sanitizer with a lotion massage to kind of calm them down, and it's just that time of the day where a lot of people experience this sundowning, well, then you're going to have to make sure that the rest of the area is sanitized. And we'll talk about how we're sanitizing the home and the living areas for our loved ones here soon.
Great. Thank you, Adrian.
Sure. So another suggestion that we've come up with the Alzheimer's Association is to ask your pharmacist or doctor for prescriptions for a greater number of medications to reduce the trips to the pharmacy. So if you are getting a refill that's a once a month refill, it's proper to call your doctor and ask them if they can make it a 3-month. That way you don't have to go to the pharmacy so often. Most of the caregivers are actually doing the trips to the pharmacy for their loved ones. And if most of the time those places, since they're considered essential, like the grocery stores, like Walmart's, they're going to be frequented by people out in the community. And that is more than likely where the virus is going to thrive, is in those areas. So the less frequency you have to leave the house or go do these types of pharmaceutical runs, the better. So it's proper to go ahead and ask them if they can make it a 3-month. Some medications, there's limitations, but Medicare and a lot of the health insurances are being extremely flexible in regards to expanding those timelines when you can get refills and stuff. Okay, it's always smart to think ahead and make alternative plans for our loved ones. Should an adult daycare or a respite program be closed because of the COVID-19 virus? Okay, so if you have to work, it's good to think ahead and make alternative plans for someone to be there with your loved ones if you have to work, or even if you yourself become sick. So we have to start thinking a little bit more in advance to make sure that all the stuff that's closing down, that we do have coverage and someone can stay with them. Okay. I know the Alzheimer's Association has a phenomenal respite reimbursement program that, in my opinion, is extremely underutilized. And they actually provide funding for hiring a caregiving agency, or even paying a friend or loved one to go and stay with your loved one for a period of time. So that would actually help lessen the financial burden of that. But there is agencies that are willing to work to go to the house and make sure to take care of your loved one if for some reason you have to get out and go do stuff and run errands yourself. So these tips for caregivers, they're coming directly from the CDC. They've also provided guidance on preventing COVID-19 in nursing homes. They're providing guidance into preventing the spread in long-term care facilities as well. This link that'll be provided to you guys at the end of this presentation will send you directly to there. So if you work in assisted living facilities, it's good to go there. I'm sure your staff is already being well trained on this, but this is a way to further personally educate yourself so you can understand why it is the changes that are going on in the nursing homes are being done. This guidance is for the health and safety of the individuals living and working in those community-based care settings. So based on each individual location, these changes can be different. Okay, some people aren't allowing visitors. I think most people right now aren't allowing visitors, and some people are. So we'll talk about that here shortly as well. You're going to want to check with the care facility regarding the procedures managing the COVID-19 risk. You want to ensure that they have your emergency contact information and the information of an other family member or a friend as backup. So we have to understand that there's a chance that we also can receive the virus and get it. If we get sick, who's going to take care of our loved one at that point? Okay. This is a very difficult situation to deal with. A lot of family members rely on one person. Even in large families, they've all voted on one person who's going to take care of mom or dad. In large families, there may be some people who aren't as helpful as others. So it's going to have to come down to a real hard conversation of, okay, if I get sick, who's going to step up to the plate? And this sometimes is going to have to happen. Um, if not a family member, a friend who you can train them in understanding all the differences that are going on with our loved one, to come back in there and be your backup as well. Also, during this time, it's extremely stressful. Even if you don't get sick, you're still having to deal with the stresses of community response to COVID-19, your nuclear family's response to COVID-19, and now you're taking care of mom and dad's response to COVID-19. That stress is extremely difficult. I know we're all feeling it right now. So if that's the case, it does help to have a friend or a family member as backup just so that you're not doing it alone. Okay. If there isn't anybody that you can call on, that you can rely on, that'll help you out, there's always home care agencies. And if not, home care agencies aren't an option for you, there's always church organizations that'll provide assistance. There's somebody out there to help. I like to tell my clients that when they feel like they're stuck between a rock and a hard place, to understand that they're not. All they need to do is reach out, and more than likely they'll find someone who can help. Okay.
Adrian,
Also, yes,
if I could
sure.
interject for a second, would it
Mhm.
be a good practice to possibly now sit, if you haven't already, maybe sit down and organize sort of a file to hand over for your loved one, maybe things that work when they are having some signs of sundowning,
Sure.
and also organize, best practices that you as the caregiver do as a routine for your loved ones, just in case you do have to hand them over, say, if in the event you as a caregiver become sick and need to recover or self-isolate or, hopefully not, be hospitalized. But if that is the case, it's good to be prepared with sort of like even a organized file or journal to hand over to somebody.
You're very right. That is a phenomenal suggestion. In fact, for our clients at Crossroads in home care, many of them actually keep a folder or a notebook in the house that caregivers are encouraged to write down what is working and what is not working with their loved one, to make sure that we're always trying our best. Now, it's going to differ from day to day, and not everything in the book is going to work all the time. But the more detailed notes you put into that notebook, the better the situation is going to be if someone who is not yourself has to go in there and help out with mom or dad or our loved ones. This technique has proven very effective in the home healthcare setting, in order to reduce the frustration and the confusion, especially during the sundowning time. So just a simple, a spiral notebook is actually something that'll work really good in that time. Any notes you can put, they like this type of music. This time of day is the best time of day to turn down the lights and make the house a little more comfortable. This temperature of the house is where they feel the most comfortable. Things like that. Any tips and tricks you can give to someone else is extremely important. And that's a great suggestion, Denise. Thank you. So, when we're experiencing any signs or symptoms of the illness ourselves, it is important that you do not go visit them. Okay. This particular virus is extremely tricky, and that's why it's been able to spread so quickly through our communities, is that even when we're not feeling any signs or symptoms of the illness, it can still be contagious. So that therein lies the problem. So if at any point you do start to feel the signs and symptoms of an illness, that is your clue to stop right then and there, because you want to mitigate as much time as possible that you have with your loved one in order to not give them that virus. Okay. So as soon as you start to feel the dry cough, As soon as you start to feel the tightness in the chest or the temperature starting to rise in your own personal self, that's your moment to hand off the care to someone else. So make sure you have a backup person. Like Denise had said, make sure you have a folder or some type of information that you can leave with them in case you're incapacitated and cannot give them any tips or tricks. So that's a really good suggestion. So depending on the situation in your local area, care settings may limit or not allow visitors. This is very true here in the city of Las Cruces. Most of the facilities are on lockdown. They're not allowing anyone to go and visit their residents who are living there, the loved ones who are visiting there, and it can be difficult to see your family member. If visitation is not allowed, simply ask the care setting how you can have contact with your family member. I'm sure you all are seeing on social media and in the news how video chats or telephone calls are being used right now for visiting with our loved ones, okay? These true heroes who are working at these facilities are going out of their way to ensure that they're not spreading the virus themselves either. You may see it in the news recently as well that a lot of facility setting virus has spread amongst the patients and the staff themselves, and that's an extremely difficult thing to mitigate. It's extremely difficult to stop that virus. Once it's there, it's gonna go. It's gonna take feet and run off. So they want to make sure that nobody's bringing it from the outside world. What they're doing at the facilities is they're checking all of their employees as well. Okay, the caregivers, the nurses, the kitchen staff, the janitorial staff. Every single one of these people is getting their temperature checked first thing. We're doing it here at the Crossroads Intended Care office. As soon as we walk in, we're being asked, are you feeling any of the symptoms? Now, since it's considered community spread, we're no longer asking, have you traveled outside of the city? Now we've gone to, are you feeling the symptoms of this, or this? Are you feeling the symptoms of the cough? Are you having a fever? And we're actually checking their temperature at the door before we're allowing them to come in. Also, we're asking, and I'm sure you're going to see this at the different facilities, that anybody who comes in is actually wearing a face mask. And masks right now are extremely difficult to get, but we're going to show you some examples of what we can do to use that to spread to stop spreading the virus. You may have also seen recently a lot of facilities actually just having people walk up and go to the window. That's one way that they've actually been able to keep in touch with their loved ones, is just a window talk, okay? There's been some really cute videos of grandchildren putting tape on one side in a tic-tac-toe and actually playing tic-tac-toe with their loved ones on the other side. So there's ways we can do that. Let's not let this virus keep us from communicating and being able to reach out to our loved ones. It is extremely important that they know that we are there for them, and that the isolation that they may be feeling is going to be temporary, and that we have a lot of loved ones on the outside waiting for them. Okay, so if your family member is unable to engage or do the video chats, there's different ways that they can get together and show that they're being taken care of and that they're loved. So how do we keep them from staying healthy? I mean, how do we make sure that they are staying healthy? We're going to pay attention to flu or pneumonia-like symptoms in ourselves as caregivers and other people in our immediately caregiving family, and report them to professionals immediately. We want to make sure that if we feel sick, we're not going over there with them, okay? Following the CDC guidelines, these tips are to keep yourself and your loved ones healthy. Avoid close contact with people who are sick. If you know that they're physically sick, they have symptoms, those you definitely want to stay away. The CDC recommends 6 feet. There's new studies coming out. They're saying that even 10 feet might be a little bit more appropriate because of the spread of the droplets when it comes out of the person's mouth. You want to make sure that you're avoiding touching your eyes, your nose, and your mouth. Those are really the only ways that the virus is going to be able to get in. The virus has to attach itself to mucosa, and those mucosa are the wetter parts of your body, which would include your inside of your nose, your eye, and your mouth. You want to stay home if you're sick, and if all possible, work from home so that you're not getting this virus from anyone else that you're related to. If you or the person you're caring for has a regular doctor's appointment to manage the dementia or other health conditions, you should really call the healthcare provider to inquire about telehealth appointment. As a result of the pandemic, Medicare has recently expanded telehealth benefits to allow seniors to access healthcare from the safety of their homes. What that means is that now doctors are able to bill Medicare for phone calls, for video chats, and just doing different types of telehealth to make sure that their patients are doing well, but not necessarily having to check on them and have physical contact or that face-to-face interaction. Um, Another thing you have to do is cover your cough or sneeze with the tissue, then throw that tissue in the trash. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. So these are all recommendations that we're hearing on a daily basis. The reason why we are reiterating it here is because this is what's going to work. When we're taking care of our loved ones, we always want to make sure that the house is squeaky clean. Everything around them is disinfected because like we mentioned earlier, they may not be the best at maintaining their own hygiene and washing their hands. And it may be difficult for you to try doing the hand sanitizer technique for them or the massaging technique. That may be extremely difficult for that to happen. So if that's the case, we want to make sure that the surfaces that they touch, the remote controls, door handles, the telephone, everything that they may touch is disinfected so that we mitigate the chance of that virus being somewhere in the house. We're going to go over it again. Wash your hands with soap and water, okay? This is actually recommended more so than the hand sanitizer method. Reason being, washing with soap and water, the agitation of rubbing your hands together, and then the soap itself, the suds, is what's going to remove the virus from your skin, okay? With alcohol-based hand sanitizers, you're kind of just leaving the virus on your skin after it's been killed. With the rinsing portion, that virus is killed with the soap and the agitation, and then it's gone down the drain, okay? So you want to do that. I always recommend washing to the elbow because of the coughing technique. I do that washing to the elbow. And then I do that after every time I use the restroom, before I'm about to eat, where I'm going to be putting my hands closer to my face. Allergy season is here, so blowing your nose, coughing, and sneezing, just like that, is going to be common. We're all going to feel it right now. It just so happened that this virus wanted to hit us right when most people were afraid of pollen outside, and it's beautiful outside. We can't go out there, unfortunately, but people with bad allergies are definitely recommended to wash their hands extremely frequently. Okay, like we said, hand sanitizer with a minimum of 60% alcohol will help when there isn't soap or water or a sink around to be able to utilize it. Okay. And then always wash your hands, whether or not with soap and water, if your hands are visibly dirty. Some other things that we want to ensure. You want to make sure that you understand and that can help your loved one follow their health care as per provider's instructions for medication and care. Okay, that means you need to be extremely fluent in what the needs are of your loved one at this point. It's highly recommended, no matter what, to be their advocate, to be their number one, their go-to person who's going to take care of them. A lot of people who are caregivers actually do this unknowingly already. They want to know what medications they're on, when they're taking the medications, if they need any types of therapy, the level of oxygen that they should be on, all these subtle differences in every loved one's plan of care. We need to be extremely well versed in it. Vis-a-vis, we also have to make sure that the people who we nominate or who have offered to help are extremely well versed in this as well, should we not be able to provide care to the loved ones. Okay, we should help with basic needs in the home, the cleaning. We should help with providing support for getting groceries and prescriptions and other personal needs. This leaves the loved one staying at home, where hopefully we've disinfected it and we don't have people coming in and out, where it's their safety. Okay, that's their safe space. We want to monitor our loved one's symptoms. If our loved one is getting sicker, we want to call right away, let them know that if they already are confirmed with COVID-19, this will help, or if they have what's called a presumptive COVID-19 positive, this will help the healthcare provider's office take proper steps in order to get them into the office without having to go to a waiting room and infect other people. Ask your healthcare provider to call the local or state health department for additional guidance. A lot of states, varying, I think in El Paso and in Texas, you have to actually get a prescription from your physician before you can actually get tested for COVID-19 to use the Department of Health's guides. If our loved one has a medical emergency, you need to call 911. You need to notify dispatch personnel that they are either positive or presumptive positive for COVID-19. This is if our loved ones actually have been confirmed, okay, and they're sent back home because the symptoms are mild, okay. If that's the case, household members should stay in a separate room from the patient as much as possible, and household members should use a separate bathroom as well. Okay, so if you're a husband taking care of your wife who is, at extremely high risk for getting it, this may be a time to start using the spare bedroom. This may be a time to start using the guest bathroom, so that you're lessening the chance of spreading any virus at that point. We want to prohibit visitors who do not have an essential need to be in the home. Might not be the best time to have the pool cleaning guy come over, or the lawn guys come over, or people who aren't absolutely essential. Housekeepers may be essential if that's a chore that you cannot do yourself. So you want to make sure that housekeepers, when they're coming in, are either wearing a mask and also are doing the hand washing technique themselves, and ask them the questions if they're feeling sick, or if they've had any temperature or fever, okay? So you want to be your own mini nursing home and do the screening questions as well if they are essential need to be in your house. Household members should care for any pets in the home and not handle the pets or animals while they're sick. There is some substantiated claims saying that right now that some pets can be transmitters of the COVID virus. This hasn't been proven yet, but it's a situation better safe than sorry. Okay. Make sure that the shared spaces in the home have good airflow, such as by an air conditioner or an open window, weather permitting. One thing that we do in home care, the weather's beautiful right now here in southern New Mexico and West Texas. So we're able to open a window and put a box fan that is facing out of the window. What this is doing, this is creating a negative pressure room, okay? When you open that door, all the air is flowing through the room out that window. So even if you do cough or there is some droplets in the air, there's a good chance that they'll be sucked out and pulled out through the window. That good airflow really does help in preventing the COVID virus from staying in a room via our droplets, our breath. So we want to make sure we cover our cough, our sneeze with a tissue, and if we have that, we throw that directly into the trash, okay? When you don't have it, we're coughing into the crux of our arm, our elbow, and we're making sure that we're washing for 20 seconds and then also 20 seconds on the arm. So it's actually 40 seconds overall. We're washing our arms a lot. So you might want to stock up on lotion to make sure that you're staying nice and healthy and feeling soft, as opposed to drying out your skin, because that could also cause a problem. If skin starts to crack. I know a lot of our seniors have an issue with having really delicate skin. So when we're washing a lot, it may develop cracks or minor abrasions in the skin, and we don't want that because the virus can actually get in through that. So you want to make sure that we're actually lotioning ourselves as well. This boils down to the masks, okay? The patient should wear face masks. The CDC has just recommended that everybody wears face masks when they're out and about. There's all kinds of face masks. If you can't get the medical grade face masks, like the surgical masks, or the N95s, which N95s should be relegated to people in the medical field anyways, it's important to get yourself some homemade face masks or cloth face masks. There's some just like these ones here that have the ties that aren't very uncomfortable, that would be a little bit more comfortable even though our loved ones are wanting to take them off all the time, at least for close interactions. If we have to get close to them or they have to get close to us, that's one thing we can do. Our caregivers in the private duty home care setting are required to wear this mask when they have to break that social distancing space of 6 feet. Now, when they're cleaning and they're working around the house and they're in a separate room, they can take that mask off. But as soon as they need to go and help our loved ones, we make sure that they put it on. Okay? And a cloth one with a room for some type of filter is what's been recommended. These ones are being made by a professional company. If you don't have access to something like this, what works just as well is using a bandana like this one. Conveniently, this is a Walk to Ends Alzheimer's one. And just covering it up, looking like you're going to rob a bank, or how the lady here in the photo has had it made. There is YouTube videos on how to make these where you can use them and then wash them and reuse them. Okay, so we're not always having to draw of that supply of the surgical face masks, the pleated ones or the N95 masks that medical professionals could be using. Now, these types of masks, they're not made to prevent you from getting the virus. The only thing that's going to help you prevent from getting the virus is an N95 mask. Reason being, N95 stands for it removes 95% of the particles in air that are below 0.03 microns, which is the virus size particle. Okay, so anything up to 0.03, it'll stop it. If it's less than 0.03 microns, it could possibly go right through the mask. Fortunately, the virus is bigger than that, so it would stop on the outside, and it stops 95%, which is a very, very good amount of stoppage. These masks aren't going to do that. These aren't N95 masks. Neither are the professional-made ones or the ones made by seamstresses. But what they will do is they'll reduce the amount of particles from your breath when you're breathing of going onto surfaces or actually going into where our loved one could breathe it in as well. So, for example, if our loved ones have mobility issues and they need to have help transferring or moving around, getting up out of bed or giving them a bath, this is a time where we're going to be close to them and we're going to wear our mask and be able to not transmit whatever we have in our system if we're asymptomatic and give it to them. Something that I've realized, some of my friends here in the community in Las Cruces have realized that the mask can be a little off-putting, sometimes even scary to our loved ones who are dealing with dementia and Alzheimer's. So finding patterns that are cute and adorable, puppy dog ones, they've been drawing funny faces on theirs to kind of lessen that fear of, hey, here comes someone with a mask. Okay.
Adrian, we do have a question from a couple of people, if I can interject for a minute.
Sure.
Dominic asks if, when checking on my grandfather, do we need to start wearing masks even in his home, even though we are careful with distancing?
So I do it. Yes, I do it. I meet with a lot of potential clients who want to start services through my organization. And I always wear the mask, and I give them a heads up, let them know, hey, I'm going to be wearing a mask. Don't be worried. This is for your protection, just to make sure that I'm not giving it to you. People who are younger, who are relatively healthy, they can have the virus, be asymptomatic, and not even have a single issue. Okay, but the tricky part of this virus is that it's still contagious at that point. It's still spreadable. So wearing that mask, as long as you give them a heads up and kind of if they have dementia, you could even kind of joke about it and be, hey, look at this silly mask I got to wear. Isn't this silly? Make light of it. But in all actuality, it is recommended that, yes, we do wear that mask when we're having visits with our loved ones.
And then we have another question, Adrian, about for the cloth masks. Should we, this is coming from Alexis, should we throw them in the wash right away after use? So how many times is a good best practice to use those cloth masks before needing to disinfect them, or what are some tips on that?
That's a great question. What we've been doing is just washing them at the end of the day. Replacing a cloth mask after every encounter, you just may not have enough, and that's problematic. The virus, if we are doing it's going to stay on the inside of the mask. Okay, if we're breathing it out, it's not going to work its way through the mask if you're using a filter. There's different types of filters. You can use something like a tissue that can be put inside of the mask. A lot of the people who are making them at home are actually making filter pockets on the inside. Studies have shown that one of the most effective materials to use for a filter are actual garage shop towels like these. You can cut out a square and put it inside the mask. The reason why these have been shown to be a little bit more effective than any other material for filter use, for home filter use, is because these work even when they're wet or they have oil on them. Okay, so they'll actually be able to filter and clean stuff out even if the moisture from your mouth is causing them to be a little bit damp. Okay, or you spit when you talk and you get them wet. These will actually still work a little bit better than a tissue. Now, remember, this isn't going to prevent you from getting it. That filter isn't filtering everything that's coming in from the outside world, because these masks aren't form-fitted to your face. The N95 masks that are recommended for nurses and clinicians to wear are actually form-fitted to your face to not allow any air to come in through the sides. Okay, even my face with a beard would not be N95 recommended. I couldn't even wear one if I wanted to. So it would have to be really form-fitted to the face, and then all the oxygen or air would have to come through that mask. So these aren't going to prevent it, but I mean, if you look at it scientifically, you could up your chance by a couple percent. It'll help, but it's not the be-all, end-all answer to preventing us from breathing it in. Okay, so washing them, I wash mine at the end of every day and I switch it out. So I actually have a couple. I have 3 masks that I wear. I'll wash one and I air dry them. One thing I've been doing, instead of putting them in the dryer, now the heat of the dryer will actually help kill the virus, but it's actually really tough on these masks. These masks don't hold up really well when they get used in the dryer, especially the homemade ones where someone's using their sewing machine. They may not be the most professional, but they're doing their part, and we absolutely love them for doing their part. But sometimes they just don't hold up well to frequent washings. So you may have to look at the type of mask that you have. See if that's something that will hold up in the dryer and in the washing machine. If not, hand washing them at the sink with hot water, as hot as you can possibly take, and then hanging them outside to dry. The air and the sunshine will actually kill the virus as well. So hopefully
Emily from Las Cruces. Emily is our development manager in Las Cruces. She went ahead and put her email in the chat. And she is happy to send anybody who is interested in a Walk to End Alzheimer's bandana like Adrian's. If you would like to use that as a makeshift mask, or even turn it into a mask with a filter, she's happy to send one over. You can email her at enchaddock@alz.org, and that is listed in the chat room as well.
And Emily, if you'll do us a favor, thank you. If you'll find the YouTube video on how to make one using a bandana and hair ties. That's actually a quick, simple way. You don't have to be a seamstress to make it. There's actually a YouTube video on how to do that. So hopefully maybe you can include that onto the email as well. Thank you so much for that. That's really nice of you. So going on with what we're doing for protection, our own personal protection, okay? We're wearing the disposable face mask or the homemade face mask, and a lot of people are actually resorting to wearing gloves. For some reason, I don't understand why, but gloves aren't really that difficult to find right now as far as personal protection equipment is concerned. We're able to get gloves. A lot of people are able to get either the food service gloves, which are just plastic. They're able to use the nitrile gloves that are being used by the medical clinicians, or even latex gloves as well. Okay, one thing that I've been noticing, and a lot of people are bringing up and pointing out, is that people who use gloves at the grocery store, people are using gloves at the checkout counters, people who use gloves in the fast food restaurant businesses, or people who are personal shoppers that are using gloves, they're not removing the gloves often enough. So the recommendation when it comes to gloves should be relegated to when we're actually having to come in contact with our loved ones, body fluids, blood or stool, saliva, nasal mucus. So if they're having to blow their nose and you're throwing it away for them, or urine if they're using the undergarment, the Depends undergarments, things like that, then you should definitely use gloves. But wearing gloves out in general public isn't necessarily all that effective. Reason being is that if you touch something that has the virus on it, now that virus is on the glove. Okay. The next thing you touch, you've just spread that to something else. You spread that virus to something else. The cashier at the checkout is going to take your card, and your card may have the virus on it. You're giving it to them. Now they're going to grab someone else's card with the exact same gloves, not change them out. Well, then you're in essence kind of enhancing the problem at that point. Okay. So the gloves aren't necessarily something you want to reuse for a regular basis. And please, 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 when you're throwing them out, there's a technique, and you'll see it here, right here in the bottom corner. There's a technique on how to remove those gloves. You got to pinch one end, pull it down, and you make sure you're not touching your skin with the other glove. And then with your clean hand, you're going to reach underneath and remove the other one, okay? So this technique is what's best for removing the gloves so you're not spreading the virus. Please throw those in the trash. I'm seeing way too often so many people just tossing them right there in the middle of the parking lot, and that's not cool. So removing it, make sure that as soon as you're done, you wash your hands right away. If you're not near a sink, if you're going into a car, you have a little bit of alcohol-based hand sanitizer, you're hand sanitizing right away before you even get onto your day. Reason being is a lot of people, as soon as they get into the car, they touch their face. They check their hair, they adjust their glasses, whatever it may be. You want to make sure that you hand sanitize, or if you have soap and water, wash your hands right away. So when we're back at home and we're helping out our loved ones here at the house, this is what we should do in regards to etiquette in the home in order to prevent spreading the virus. We want to avoid sharing household items with our loved ones, meaning we're not sharing dishes, drinking glasses, cups, eating utensils, towels, bedding, or other items. Stuff that are frequently used by our loved ones, we're not sharing them and then letting them use it as well. So even as something as much as a blanket that you put over them because they may be a little chilly in the house, and then you sit down and use that same blanket, we want to make sure that we don't do that. We want to wash the laundry thoroughly and wash it separately. Wash everything that they use separately from everything that you use. That's one way to mitigate the spreading of the virus. Wash regular. Soap, laundry stuff, that's going to work just fine. You don't have to wash everything on high heat water, and you don't have to dry everything in high heat drying because you're gonna shrink everything. But just regular washing is actually going to be beneficial to keeping everything clean, and that includes their clothing, their towels, their bedding, and everything that they use. Okay, you want to clean all high-touch surfaces such as countertops, tabletops, doorknobs, bathroom fixtures, toilets, phones. Cell phones are a huge spreader of the virus because not a lot of people sanitize their cell phone often. So they'll be doing proper glove technique, pick up their phone with their glove, take off their gloves, but still never clean their phone. If that's the case, you definitely want to make sure that you're wiping down the phones in the house often as well. Keyboards at home, tablets, and bedside tables every day, everything that may come in contact with bodily fluids or stool or anything like that. Okay, so bedside commodes definitely have to be sanitized. If you have the toilets with the raised seat because they have to have a little bit of assistance using the restroom, you want to make sure that those are also sanitized as well. Use a household cleaning spray or wipe according to the label instructions, okay? Label contains instructions for safe and effective use of cleaning the product, including precautions you should take when applying the product. There's many types of products that could be caustic and could be difficult for your skin, so they might ask you to use gloves when you're using it, and of course also have good ventilation in the room while you're using it. Some of the Lysols, Pine Sols, bleaches, anything that you're using, definitely don't mix bleach and ammonia. That is one thing that'll cause problems. But make sure you have good ventilation while you're using the product as well. Wash the laundry thoroughly. Immediately remove and wash clothes or bedding that have blood, stool, or body fluids on them. Wear disposable gloves and make sure you're handling it all well, and keep soiled items away from your body when you're moving stuff around. Clean your hands with soap and water or alcohol-based sanitizer immediately after removing your gloves, and read and follow the directions on labels of laundry or clothing items and detergents, okay? The reason why I made sure that this picture was on here, because that's one thing that I've been taught by one of my best friends, Jill, who taught me a trick that she used for her dementia patients, is she has them help with the chores. This is one thing that we can do, and now, and it may be a nice little trick to get them to wash their hands. Okay, we're going to fold some towels now. I need you to wash your hands before we fold them, and then we're going to sit there and do it. You make it kind of like an experience for them to keep them busy and keep them occupied. So actually, you can have them help you with the maintaining of the home and cleaning everything. And this is one good way to get them to continue to wash their hands as well. Place all used disposable gloves, face masks, and other contaminated items in the trash, okay? If we put them in the household waste, we clean our hands afterwards, and then we throw that trash out immediately, okay? And then when you're done throwing that trash out, you got to wash your hands again. So what I tell all of my caregivers and the clinicians is we used to wash our hands a lot prior because we didn't want to give anyone bacteria that can make their stomach upset when we eat. Now we have to wash 3 times as much because we don't want to give them a virus that can clog their lungs up with mucus and kill them. So it's kind of drastic, but it's the truth. We want to wash our hands a lot, and that's the reason why it's beat into our heads from media and beat into our heads from CDC, beat into our heads in social media. Please wash your hands. You're even seeing social media challenges of celebrities washing their hands now and stressing that. So all the information has been gathered from CDC, and we have it. We've been working with it in conjunction with the Alzheimer's Association. We have varying versions of this. So you can always visit these websites to learn how to do this in Spanish and also help in English, so that we can all be on the same page and give extra knowledge. So this may be a good resource, this page here, to give to a friend or family member who's going to be your backup, who didn't get a chance to attend this program. You could always say, hey, this is the program that we went to. If they speak Spanish, we actually have this in Spanish, all this information, and they can get caught up to speed just like you are.
All of this information, Adrian, will be at alz.org, along with the recording of this presentation for anybody who needs to reference it or invite somebody else that might benefit from this presentation.
Yeah, thanks. Keep in mind the office is closed for the Alzheimer's Association, but that does not mean that we're not working hard to keep you trained and give you the advice that you need when it comes to dealing with our loved ones who are suffering from dementia and Alzheimer's. All of these resources, these online tools, caregiver forums and message boards, the roadmap for approaching Alzheimer's, the Alzheimer's Library and Resource Center, all these virtual libraries, everything is still available online. Also, we have our helpline, which is staffed 24 hours a day, 7 days a week by trained professionals. It's up and running all the time as well. So when I said earlier that you're not really stuck between a rock and a hard place, I mean it. There's always going to be someone here to help you. If you need anything, I'm sure my information will be attached at the end of this with my email and my cell phone number. You could always call me directly if you need any further guidance on how to help someone who is non-compliant and maybe just doesn't want to stick to the hygiene protocol. We can get creative and come up with tips together on a one-on-one basis as well. So with that, thank you. If you have any more questions, now's a good time to ask them. If not, we'll end the presentation here right at an hour.
Well, we do have some comments for you, Chris. I'm sorry, Adrian, coming from Chris. Very helpful information, Adrian. Thank you. Alexis wants to also thank you. This is helpful, great information. Dominique is also thanking you and appreciates the information. And Wendy does want to make a comment that she has not found any disposable gloves in Albuquerque so far. She did go ahead and purchase her mom a 2-pack of latex kitchen gloves just for something. But I think there's also a shortage in gloves. But you made a good point that sometimes those are it's just better to kind of go with washing your hands, if I understood you correctly.
Correct.
It lives on plastic or some of these other surfaces a little bit longer, so it's probably best practice to just go ahead and continue with the hand sanitizer and the constant washing for now if you're not able to have gloves. And also you could, as you mentioned, end up doing more harm than good with gloves. So yeah, it's if you don't have gloves, no worries. Just continue
Right.
to be vigilant about washing your
And
hands.
one thing you can do is if you can get a hold of tissue, I know TP, I don't know why, but it's hard to get. But tissue, Kleenexes, paper towels, they are a little bit hard to get, but some people are still able to get them. You could also pick up disposed or soiled material with the tissue as well if you can't get a hold of any gloves or anything like that. So pick something up using a paper towel or some tissue. That might be one way to do it. And then, of course, wash your hands immediately.
Great. Thank you so much. If anybody has any other questions, we'll give a few seconds before we will conclude our presentation. Again, Adrienne, many, many thanks to you for all of this information. I know it seems sort of like it would be common sense, but definitely in the middle of this, it's hard to think of everything that we should be doing. So there was some great and great practices that you gave us here. There is a comment from Wendy. Distribution chain for household and business toilet paper are different, and most need is in the household. So looks like there's some shortage there. I think that if you contact some of your local grocers, they will go ahead and let you know when they're getting shipments in, and then they also have reserved times for the senior population, where you might get first come first serve. I've also seen it's a little bit more available in the greater Albuquerque area because grocers have started to limit the amount that people are purchasing. So it's been a little bit more available at like Albertsons, Whole Foods, I think Costco. Sometimes you're lucky, and Sam's Club, but you might want to just contact them and see what their when their deliveries are and try to plan accordingly. So,
Yeah, I've had my caregivers who are doing shopping for our clients who are homebound. They've just asked and explained the situation. On a few occasions, they've actually gone. The grocery store has actually gone to the back and pulled something off of a pallet for them, just explaining, hey, you know what? I'm a caregiver for a senior who is suffering from dementia and Alzheimer's. We don't have the availability to get out here. They've listened to their story, and I hope people aren't going to exploit that information, but that's helped. Just explanation. Most city resource centers are actually figuring out ways to get seniors groceries and those essential supplies that are absolutely necessary. They do have access to that. So if you look on Department of Health website, there probably will be a good link to resources for seniors. Any senior website in regards to the city or municipality that you're in will provide you with those resources. And I'm sure here in the near future we'll develop a list just based off this conversation that the Alzheimer's Association resource page will be able to provide that information as well for our local areas. If they know of any places that are helping seniors in that aspect. So hopefully that will help.
yeah. So Alexis in Las Cruces, Alexis and Emily have come up with a local list that they posted on Las Cruces Facebook sites as well as our own Alzheimer's Association Facebook site. In addition to that, New Mexico Long-Term and Aging has a statewide number listed at their website that you can actually call and let them know if you have no access to some of these essentials, and they will get with your local. They will try to do their best to go ahead and help anybody out. So just if you need any help with resources, feel free to call our 800 line and we can get you those local resources to you.
Great, great. So this is going to pass, and we're in a hard time. It's new for everyone. I never knew that I would not be a home care administrator, that I would be a logistics expert for textiles and sewing materials, that have volunteers make masks. We're all putting on different hats right now in this difficult time that we're experiencing, but it will pass, and we're going to get stronger and we're going to get better. That's the beautiful thing about our communities, is that every time we're faced with hardship, we've always come out better. And I know you guys, for coming part of this presentation and learning just a little bit more, and getting that washing your hands beat into your head a little bit more, we're all going to do better. And we're going to take care of our loved ones, and we're going to get back to some type of normal, a new normal. And when that time comes, we're going to hug each other, because I know we're all in desperate need of a hug right now. So thank you guys for being part of our presentation.
Thank you, Adrian. Have a good day. Thank you, everybody.